I'm Brittany.
And I'm Grace, and we're here to tell you today about what we think matters most in global environmental health. The general public needs the ability to effectively respond to their changing environment through the use of informative health literature. Not all information, though, is as it seems, and without a critical mind, you don't really know if whatever environmental risk that the article is talking about really applies to you.
This is the idea behind health literacy, which is the ability to obtain, read, understand, and also use healthcare information to make appropriate health decisions. This sounds like a simple idea, and it is, but it's not something that we are taught. These are often skills we have to learn for ourselves.
So GMOs, environmental contamination, contaminated foods, goji berries, superfoods, vaccinations, these are only some of the environmental health risks that you may have heard about from various news sources or social media sites. But do these environmental exposures really pose risk to your health, or are they actually that good for you? The problem is
that not all health articles are truly informative, as they can be based on pseudoscience or half-truths. You need to be able to determine these half-truths from the whole ones in order to fully understand the risks in your own environment. We're here to help you out with that.
So here's a familiar framework, and these are your tools for debunking fact from fiction and health-related literature. Who, where, why, what, and how are all things you can ask yourself when reading these articles to make sure that they're really reliable sources.
So first, who? Who is providing this information? Is the researcher credible? Because also the person writing the article that you're reading may not have done the actual study. So you want to know, the person who did the research, do they have verifiable credentials? Do they have an MD, a PhD, or even an MPH? You know, because if they work somewhere reputable, they're also going to want to tell you about that. If they went to Harvard, they're gonna brag.
Wait, so does that mean that we're credible people?
I think so.
I think 4 years in McGill Environmental Health, we're up to the task.
I agree.
The next tool is where. Where was the information published? The credibility of the article really relies on where the original source came from. So was it from a peer-reviewed publication like the New England Journal of Medicine or a news source like BuzzFeed? The news media needs credible sources, so you should always look into the citations of where their information is really coming from.
When? When was the information collected and when was it published? If this happened around the same time, you're probably good to go. But if there's a gap, you should pay attention. Because if someone's writing an article now about information collected 10 years ago, the information probably doesn't hold true. Think about it. We don't think the world is flat anymore. Things change. Also, if you only recently became affected by an environmental hazard or a disease, you're only just starting to do research. And you may come across old information, but science is always changing. The facts aren't constant.
So the next is why. This is a big one. Oftentimes certain media sources, or if they're talking about health problems, they're going to use celebrity or flashy stats used to draw in your attention. Make sure that you're reading between the lines of the article and not just looking at the pictures or the statistics that they're trying to use to get your interest.
So how does the article use statistics? Grace said they could be flashy. So how do you know if they're useful? How do you know if you could trust them? If 80% have this disease, 80% of who? Is it boys? Is it girls? Is it lions in Africa? You need to know if this applies to you so they could provide comparisons. You need to be able to strip these numbers down and see if they're biased or not.
So finally, what? What is the connection to your own life? Are you reading an article about goji berries when you've never had one and trying to see the health benefits? Are you worried about noise pollution if you live in the country? These are all important things to keep awareness about, but if they don't apply to your own life, we certainly don't want you to become panicked. And part of that is making sure the information is credible.
So this is your toolbox. Who, what, when, where, why, how. These are the tools to help you become independent and informed about the choices you make to protect yourself from potential hazards in your environment. Be your own health advocate.